This is Dr. David Barron. Everyone feels anxious or nervous from time to time. In fact, it's an evolutionary adaptation that's crucial to survival. And on some level, pretty much every animal is capable of feeling it. If you didn't feel anxious when you saw a bear or heard a lion roar, it might not occur to you to run like crazy in the opposite direction. And a little anxiety generally sharpens the mind and senses and even improves athletic, musical, theatrical, or academic performance to some degree. But exactly what one feels, what we call anxiety, certainly varies from species to species and from one human being to another. Anxiety is sort of like the flip side of stress. Think of stress as the circumstances, conditions, or situations, whether real or imaginary, that provoke some kind of reaction in us. If that reaction is involving emotional or physical symptoms, we generally label it as unpleasant, painful, or undesirable, and you might call it anxiety. First, when there really are no identifiable factual, perceived, or imagined stressors, then we're getting into the realm of psychological disorders such as generalized anxiety, panic attacks, and even obsessive-compulsive disorder, or agoraphobia. In these situations, it's highly advisable to seek out professional guidance in the form of counseling and sometimes prescription medications. Second, there are a number of underlying purely medical conditions that can produce symptoms identical to those of anxiety, like an overactive thyroid gland, or even side effects of certain prescription or over-the-counter drugs, such as common asthma inhalers and decongestants. Or excessive caffeine intake can do it. Those may need to be ruled out by a physician or nurse practitioner before making a psychological diagnosis. Finally, symptoms of anxiety are frequently and especially the result of voluntarily putting various drugs or chemicals into your system, like excessive caffeine, non-prescribed use of stimulants, like Adderall, cocaine, or marijuana. That's why marijuana makes some people feel paranoid. Even alcohol can do it. Not putting food in your system regularly can do it too. Skipping or delaying meals, or eating a junk diet too high in sugars and starchy carbohydrates and not enough protein. So it's important to notice the relationship between your habits and your health, or rather, your potentially unhealthy habits and your symptoms or condition. You may not be able to control many of the most common stressors in your life, and it's important to recognize what you don't have control over, such as the weather, traffic, world events like the pandemic, the economy, natural disasters, your genetics, and, other people. But you have a lot of good quality choices for reducing the amount and severity of anxiety you may feel as a response to all those things. Getting good quality regular sleep and regular exercise reduce anxiety. And doing some brief but relatively intense exercise in the case of acute anxiety absolutely works too. Meditation is an excellent tool to manage anxiety, as are Tai Chi, yoga, acupuncture, massage therapy, and various other disciplines that combine meditative benefits with physical ones. There are so many opportunities to try these activities, ranging from classes to instructional videos, of which there are lots of free ones on YouTube, audiobooks and print books. Journaling is an excellent tool for reducing anxiety too. And last but not least, talking openly, honestly, and regularly to a non-judgmental and supportive friend or family member or health professional works wonders to calm the mind and the body. But you knew that already, didn't you? This is Dr. David Barron, and I'll be back to talk to you about your health matters, because your health matters.